Thank you for joining us for session 6 of the 6-part Family Caregiver Education series brought to you by the Alzheimer's Society of Nova Scotia. My name is Beth House, and I am the Coordinator of Education, Outreach, and Support in our Halifax office. The content of this session could bring up questions and emotions. There will be a phone number to call for support at the end of each of these sessions. This session will look at responding to changing care needs. Before we begin, I'd like to acknowledge that we are on sacred land that has been the site of human activity since time immemorial. We are in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people, and we acknowledge them as the past, present, and future caretakers of this land. This session, we will look at the changing care needs and resulting caregiving considerations. We will talk about resources to support the changing needs of people living with Alzheimer's disease and other dementias, and how the changing abilities of the person with dementia increases their care needs, your ability to meet those changing needs, and how to access additional supports and services. This session will focus on identifying criteria for making decisions about your situation, awareness of supports in the community, government-based resources, including financial resources, and the process of long-term care access in Nova Scotia. Take a moment to think about the changes that you've noticed in your person's abilities that require more support from you. Do you need to offer more frequent reminders? Are you now paying the bills, doing more cooking, or all of the driving? Do you need to remember when to have the furnace checked or the oil changed or to water the houseplants? And how do these changes impact your day-to-day life? As dementia progresses, caring for your person with dementia will become more difficult, and they will need more support from you and from others. Remember that not all people with dementia will experience all of these symptoms. Everyone is unique and will experience their own changes. They may have communication difficulties, so your person may have problems understanding others or expressing their own thoughts and needs. They may experience anxiety or restlessness, maybe sleep disturbances. And keep in mind that all behavior has meaning. These symptoms may be a result of the underlying emotions of frustration, boredom, confusion, anger, pain. Your person could have a decline in their memory. They may have difficulty recognizing people, remembering events. Maybe they're misplacing things, sometimes important things. The person with dementia could show changes in their personality, such as sudden mood shifts or behaviors they didn't have in the past. They may become less inhibited and want to hug or talk to everyone that they see. They may experience paranoid or delusional symptoms. So your person may see, hear, or even feel things that aren't real, but feel real to them. The key here is that whatever they are experiencing, it is real to them. They could require an increased level of care. If they are having difficulty following multiple steps, they may need help with everyday activities like brushing their teeth, getting dressed, taking medications. As well, there could be concerns around personal care, such as hygiene or possible bowel or bladder incontinence. They could be experiencing increased disorientation. They may have difficulty navigating throughout the home in the later part of the disease, finding the bathroom from the bedroom or the living room from the kitchen. They could also have a high risk of getting lost outside. Your person at some point may need full-time supervision. So, what does this mean for you? As the disease progresses and the person becomes more dependent on others, and providing care will become more of a challenge. Roles and responsibility change and increase as the disease progresses. This can increase your level of stress and may affect your quality of life, decrease your patience, and may affect the quality of life of your person with dementia and affect the quality of the interactions that you have. You may need some additional help and support. Sometimes the biggest barrier to getting help is recognizing that we need it and that we can't or shouldn't do it all. Dementia is a tough disease, and getting help in a timely manner ensures that the person with the disease and you, the caregiver, are receiving the best help and support possible. It takes a village to navigate this journey. Considerations of changing care needs. Caregiving for someone with dementia can be overwhelming at times. The following questions are good guidelines to help you decide when you need help. When you're deciding about care for your person with dementia, consider, are there safety concerns? Is your person wandering or leaving stovetops on? Do you need special equipment, such as grab bars installed or a wheelchair? Are there special transportation requirements? Is space an issue? If a walker or a wheelchair is needed, is there sufficient space in the home for safe mobility? If the fire alarm went off, would your person know how to respond? And health. Is the health of your person with dementia or your own health at risk? Think about not only the physical health of both of you, but your mental and emotional health. Are you able to provide self-care for yourself to maintain your own overall well-being? If you're feeling tired, emotionally drained, lacking support, ask yourself, is this helpful? Consider your emotions. Are you feeling a loss of companionship as your person is changing? Is there a role reversal? Loss of friends, loss of independence, increased isolation, grief, guilt? And the care partnering role. Have the needs increased and become more complex beyond what you are able to or comfortable to meet? Bathing, lifting, managing medications, assisting with meals and feeding, incontinence. You may be comfortable helping with personal care. However, your person may be 6 feet tall. And if you're only 5 feet tall, you may not be physically capable, even though you want to. What about your other responsibilities? Children, spouse, friends, grandchildren, relatives. Will someone or something be neglected if you devote all your time and energy to your person with dementia? Is this journey impacting your job? Are you able to take a leave of absence or cut back your time? Do you have flexible work hours? Are you even able to continue? Finances. There are lots of costs associated with care. Can you afford to hire help? Is it live-in care or part-time care? Can you pay for specialized nursing services? And what about the cost of renovations or medical equipment, grab bars, a walker? What does your insurance cover? You need to start to plan ahead and to think about what resources can help and are available to you along the way to support you and your person with dementia. The answers to these questions are unique to your own situation, your own skills and coping abilities. They will help you decide when you need support and what types of support and caregiving options may work best for you. Do you need to hire a housekeeper because you can't keep up with the chores and provide personal care? Maybe the lawn is neglected, so you need to ask for help with the mowing and the weeding. However, if the garden is your happy place and the kitchen not so much, then maybe the right choice for you is a meal service rather than a lawn service. Or perhaps you need to look at home care to help with personal hygiene, giving you the time to enjoy making meals in the kitchen. Good news, help is available. As we have mentioned, the type of support needed will vary with each situation and also vary at different points along the journey. We will explore some of the support options that are available and how to access them. Just a reminder that many of these options can be accessed through both private and public funding. I will be speaking to programs available in Nova Scotia, and for more information about programs and services in your province, contact your provincial government or your local Alzheimer's Society to find out more. Depending on where you are located, these are some of the services that may be available to you. These services may require referral or service coordination, and we can help you navigate that. Adult day programs. So individuals with dementia can attend this program that includes recreational activities, meals, music, with a focus on maintaining the abilities of the person with dementia. Not only is this a great experience for your person with dementia, it is an excellent opportunity for you to focus on other priorities such as yourself. Specialized equipment can be obtained through services like the Red Cross or community-based organizations like the Lions Club. They often have equipment for loan or rent, such as wheelchairs, walkers, medical beds, raised toilet seats, bed rails. And it's often nice to try before you buy to see what will work for you and your person. Home health departments in your local pharmacy also have various equipment and assistive devices. Don't be afraid to ask, is there something that can help with? Because if you're having a challenge, chances are someone else has had that same challenge. Food support, such as meal delivery companies, Meals on Wheels, the frozen favorites from VON, are great options for support. And grocery stores have a great selection of healthy prepared meals now. Transportation through the VON or community vans and drivers or the Accessibus. Programs for visitation provide companionship and meaningful engagement for the person living with dementia and can provide respite for the care partner. Explore your local service clubs, neighbors, faith communities for what they might have. There are also friendly calling programs through Northwood and the Red Cross. There are older adult services, social activities, senior housing, seniors groups, home and personal care, mental health services. There's counseling, support groups, and different organizations such as Caregivers Nova Scotia. Seniors mental health through Nova Scotia Health offer a range of outreach, outpatient, day programs, and inpatient services to seniors and individuals living with dementia at any age. These may include occupational therapists, social workers, nurses, psychiatrists, and a lot of the time physician referral is required. The Legal Information Society of Nova Scotia provides legal information and lawyer referral services to people across Nova Scotia. They can be reached at 1-800-665-9779, or you can find them online. 211 is a free and confidential 24-hour helpline and website that helps connect you to non-emergency government, community, and social programs and services such as the ones we just went over and more. They are a fabulous resource. Some other services available. Many places have curbside pickup now, from restaurants to grocery stores and pharmacies. You can order online or over the phone, and they'll bring it out to your car, so you don't have to go inside and leave your person in the car, or if your person is overwhelmed by going in and out of stores for errands. Consider friends, neighbors, faith communities, services at home and online, service clubs when you're organizing your daily or seasonal tasks, such as picking up the dry cleaning, groceries, prescriptions, yard cleanup, going for walks, driving to appointments, having friendly visits with a pet, or doing home repairs. Community agencies and businesses provide assistance with everyday tasks, and services may include referral and service coordination, making applications for various programs, advice, budgeting, household management, making moving or funeral arrangements, taking blood or other samples, income tax preparation, massage, foot care, hair care, dental care, as well as crisis intervention. So I will be speaking to the programs that are here available in Nova Scotia. And for more information about programs and services in your own province, please contact your provincial government or your local Alzheimer's Society to find out more. So here in Nova Scotia, our continuing care serves people who need ongoing care, either on a long-term or short-term basis. In Nova Scotia, continuing care services, including a range of home and community care and long-term care services, are administered and delivered by the province and funded by the Department of Seniors and Long-Term Care. You can get help in the home to support you in your caregiving role and to enable the person with dementia to continue living as independently as possible in their own home. Home support or home care can be obtained publicly through the Department of Seniors and Long-Term Care. You can also hire privately for services. You can find private agencies under Home Healthcare Services in the Yellow Pages or in the Positive Aging Directory, or you can give us a call at your local Alzheimer's Society. Home care helps people of all ages who need assistance to maintain their optimal well-being and independence at home. It serves clients with a varying degree of short and long-term illness and disability or support needs, including acute, chronic, and palliative needs. Services are meant to add to the help your person receives from others, such as family, friends, or the community. These services include home support, such as personal care, meal preparation, essential housekeeping, respite, nursing services, such as dressing changes, catheter care, or intravenous therapy. There is no cost for the nursing services, and home support fees are based on income and family size. So this is a general overview to show what is available either through continuing care or private home healthcare companies. Home care services supplement the help people already receive from their family, friends, or through the community. Through home care, people are able to remain as independent as possible by staying in their home and their community. It is always the first option for care in the community. So nursing care is based on need and if assessed as needed. Services could include catheter care, post-operative care, diabetes monitoring, wound management, medication monitoring. Personal care services help with tasks of daily living, like assisting with a tub bath or shower, helping to dress, toileting, feeding and meals, and mobilization. It could include some housekeeping, so light housekeeping duties, meal preparation, laundry, and this service is only provided if there is no able-bodied person living with the individual needing support. To access home care through continuing care, you can call 1-800-225-7225. You will be assigned a care coordinator who does a financial and needs assessment. And if you require an assessment for home care, a care coordinator will arrange a time to meet you to complete the assessment. The assessment will determine what care services you are eligible to receive based on your needs. Home care adds to the help you currently have in your community. It does not replace existing care. The financial part, the costs are based on the family assessment of income. Assets such as property and investments are not included. There is no cost if the assessed income is less than a defined amount. Otherwise, the costs are on a sliding scale. A needs assessment is done to determine the level of care your person with dementia requires. They may consult with other partners such as doctors, geriatricians, social workers. It's helpful to have a knowledgeable partner in care available with the person with dementia for the needs assessment to provide additional information. You can request reassessment and additional services as needs change. Continuing Care Nova Scotia has a home-first approach. Nova Scotia Health will explore all options for home care and community supports. For more information on continuing care services, you can visit their website, give them a call, or connect with your local Alzheimer's Society, and we'd be happy to share their brochures. Respite allows for a break for the caregiver. to attend to your own health needs, to attend to other responsibilities, and it provides a break away from the 24-hour-a-day, 7-day-a-week caregiving responsibility. And it's an opportunity to recharge your own batteries. It provides more social contact for the person living with dementia and offers them a break from the caregiver. When you think about it, home support and nursing home staff don't work 7 days a week, 24 hours a day. They work shifts. They have regular night sleeps, off hours, and weekends. So there are 3 types of respite. In-home respite, where the worker will come to your home for a few hours a day or 2 to 3 times a week. There's respite care in facilities. And so Nova Scotia Continuing Care offers 60 days per year, depending on availability, if you meet the criteria. And to find out more about that, you can contact Continuing Care. And adult day programs are another wonderful way for some respite for both the person living with dementia and the partner in care. So in addition to meeting the needs of the person with dementia, it does offer respite for the partner in care. These are separate from continuing care, and arrangements need to be made privately. Other continuing care programs include the Caregiver Benefit Program, which recognizes the important role of caregivers. It is intended for caregivers of low-income adults with a high level of disability or impairment, as determined by a home care assessment. A caregiver must provide over 20 hours a week of unpaid care to qualify. If the caregiver and the care recipient both qualify for the program, the caregiver will receive funds per month. The caregiver benefit is a reportable income, and caregivers should contact the Canada Revenue Agency for information about tax implications. This is a small stipend that is intended to show gratitude for all of the hard work that care partners do. The supportive care program supports cognitively impaired clients and their substitute decision maker with funding per month to purchase home support services such as personal care, respite, meal preparation, homemaking, that would otherwise be delivered through the home care program. Under supportive care, a person may also be eligible to receive reimbursement for stove removal services per year. Other supports from continuing care include the Home First Funding Program, instrumental activities of daily living program, equipment programs such as the Personal Alert Assistance Program, Home Oxygen, Home Community Bed Loan Program, Seniors Community Wheelchair and Specialized Equipment Loan Program, Community Occupational Therapy and Physiotherapy, and the Responsive Behaviors Program. You can find more about these programs on the Continuing Care website or by calling 1-800-225-7225, or reach out and we can share those brochures as well. There are also programs available through the Veterans Independence Program, such as financial assistance for grounds maintenance, housekeeping, personal care, and nutrition. The primary caregiver may also be eligible. Regarding long-term care for veterans, there are veterans' homes and beds in facilities. And for eligible veterans, those that are usually already on allowances, example, prisoner of war, disability, war veterans allowances. And there is also financial assistance to purchase services. There are some nursing homes, such as the Abbey J. Lane in Halifax. There's also beds in facilities that are assigned to veterans. To find out more, if you think you or the person with dementia may be eligible for support from Veterans Affairs, reach out to Veterans Affairs at 1-866-522-2122. You can receive support from both Veterans Affairs and Continuing Care. As the disease progresses, the person with dementia staying at home may no longer be a viable option. Their care needs may be too great. The physical design of the home may be too difficult, or more services may be needed. Some people make changes such as downsizing to an apartment or moving in with family. Also, there are facilities set up to offer different levels of support. Not all options are available in every community. The costs will differ and there are wait lists. Assisted living or retirement homes are privately owned facilities designed to meet the needs of independent seniors. These homes are not licensed to provide care, but they can be an option for persons in early stage who are fairly independent but would benefit from meal preparation, light housekeeping, and social interactions. If the care needs increase, the costs may increase. You may have to hire outside help, and that could be through continuing care, or you may be required to move. Your person with dementia may still qualify for home support services while living in retirement or assisted living facilities. Long-term care facilities are licensed by the Department of Seniors and Long-Term Care, and they're accessed through the Nova Scotia Health Continuing Care Coordinators. So there are a few types. Residential care or small options homes are approved and licensed to provide care for persons who require supervision and limited help with personal care. And availability may differ for this throughout the province. Nursing homes or long-term care are licensed for persons who need help performing everyday tasks such as dressing, bathing, toileting, and are medically stable but have nursing needs that can't be met through home care. Other services may include physiotherapy, occupational therapy, recreation, social work. This is most commonly where persons with dementia live in the later stages of the disease. Long-term care provides accommodation, supervisory care, personal care, nursing services to individuals who can no longer live independently in the community with family or the other supports available. Licensed facilities are those approved by the Nova Scotia Department of Health, Seniors and Long-Term Care, meaning the facility follows policies and standards to ensure that there is a consistent quality of care provided to residents. There are also private long-term care homes that are not funded or subsidized by the province. The person will need a valid Nova Scotia health card. So for a person with dementia coming from out of province, they would be required to pay for their own care until they can meet the provincial requirements of living 3 months in the province. If this is an issue or a concern for you or your person with dementia, it should be directly discussed with continuing care. The person also has to have care needs that can be met in a nursing home. So this means the person meets the minimum requirement for nursing home placement. They require the availability of personal care or supervision on a continuing 24-hour basis. But also, their needs are not so great that they would be better attended to in a hospital. For example, an unstable medical treatment that can't be looked after in a nursing home. Nursing home placement is appropriate for people who are medically stable but have nursing needs that cannot be met through home care. If you are considering home care services or a nursing home placement and you don't already have a care coordinator, call Continuing Care. If you are already receiving their services, talk to your care coordinator. Nova Scotia Continuing Care has a home first philosophy, and long-term care is only explored after in-home options have been exhausted. You can request specific long-term care facilities. Continuing Care makes sure that care needs are met first, and where possible, accommodate your facility preferences. At the time you apply for a nursing home, you must be ready to accept placement. So if you were called the next day and offered a placement, you would accept it. This is the Continuing Care policy as of March 2015. If an offer of placement is refused, they will be removed from the waiting list, and individuals who refuse a placement offer and wish to reapply will have to wait 12 weeks unless there has been a significant change to their health status. Be in touch with your continuing care coordinator and let them know how things are progressing. Earlier on in the journey, you may decide to only have 1 or 2 long-term care homes on your list of preferred homes. And as the needs increase and the care needs become more, you may decide to add a few other homes onto the list to cast a bit of a wider net. but that is up to you and your person with dementia. Almost all nursing homes are accessed through Nova Scotia Health Continuing Care. The continuing care coordinator will do a needs assessment and also a financial assessment to determine what you pay on a sliding scale. Long-term care is paid for jointly by the province and by the long-term care recipient. The care coordinators look at the income of the person with dementia and their spouse or partner and any dependent children. Assets such as the house and car are not included in a financial assessment, and people do not have to sell their homes in order to pay for long-term care accommodations. If there is a spouse that is still living in the community, they will retain a portion of the joint family income and maintain control over their assets. The Department of Seniors and Long-Term Care covers the health care component, and the residents pay the accommodation and food portion on a rate set by Nova Scotia Health. For those who cannot pay the standard accommodation charge, there could be a reduction through financial assessment based on their income. And residents do pay for their own personal expenses. So there are no rules guiding when you will come to the conclusion that a move is necessary. You may consider a move for a variety of reasons. The condition of the person with dementia has worsened. They may have been in the hospital and their needs are becoming more complex, so they require more help on a day-to-day basis. You are concerned about the person's safety. You no longer feel able to provide the full-time care that the person requires to enjoy the highest possible quality of life. Your health and abilities have changed, or you are exhausted. When considering how best to meet the needs of the person with dementia, you need to remember to balance their needs with your own well-being. If you're thinking of placing your person with dementia in a nursing home, a good strategy for selecting a nursing home is to visit some homes and ask staff questions. Maybe you can even speak to other residents or their family members. Develop your own checklist of things that are priorities for you and your person with dementia. Talk with other people who have someone in that facility or in a facility. Here are some things to consider. What is the philosophy of the home? Is it person-centered or medical model? Are the staff trained in dementia care? Is there a separate space for people living with dementia? Is that locked or secured? How are responsive behaviors handled? Does it look like a good place to work? Do the staff appear happy? Is it a good work environment for the staff? Is the facility clean and friendly, as well as dementia friendly? Or does it seem institutional and sterile? Are the rooms or the bathrooms single or shared? Will you be able to visit easily? Do residents and families have a voice? So connect with your local Alzheimer's Society for tools, checklists, and more information. We do always recommend that you visit the facility before adding them to your list. It would be awful to arrive on move-in day and for the home you've chosen not to be what you've expected. A lot of long-term care homes are now offering virtual tours. At some homes, the person with dementia may be able to attend activities with a partner in care to become more familiar and be more comfortable. Some other things to take into consideration are, how do they incorporate residents' interests and dislikes? Are there meaningful activities for the residents? What are their policies regarding people visiting? Are there policies for the use of restraints, either physical or chemical? What furniture and other personal belongings can you bring? Some homes may give you a sample of their menu, their recreation calendar, and they may have informative websites with pictures, or they might be on Facebook, which can give you a bit more insight into the daily life in the home. So how do you decide? When is the right time? So gather your information, focus on the facts, review all your possible options, look at each one and weigh the pros and the cons. Try to stay realistic and acknowledge your own abilities and your limitations. Think about the relationship with your family, your spouse, as well as the person with dementia. Try to stay focused on what you know, not the what ifs. Involve other family members as appropriate. We all know there are many facets to family dynamics, so do what's best for your situation. Involve the person with dementia as much as possible, and again, as appropriate. Try for their best time of day, and if it's upsetting, then ease off and try again later, or not. And consider the consequences of putting off a decision like this. The consequences to you and your health, as well as to that of your person with dementia. Balance your needs with the needs of your person with dementia. Everyone with dementia will have their own unique journey as the disease progresses. Making care decisions can be very tough. In this session, we've focused on the reality of the disease. The person with dementia will become more dependent on others and will need more support. That's inevitable. What the support needs to be and what that looks like is as individual as the person and their support system. As a partner in care, at some point, you most probably will need help and support from others. You can't and you shouldn't do it all alone. It takes a village to support you and your person with dementia on this journey, and that village can include not only those closest to you and your person with dementia, but the home care agency, the day program coordinator, the pharmacist, a foot care nurse, a new neighbor, and a VON volunteer. We have explored different types of support that are available: community programs, home support, respite, and long-term care placement. It is good to know that you are not alone. Bringing in additional support provides the care and services to ensure that your person with dementia has the best quality of life, and that you as a caregiver are supported in your changing caregiving responsibilities so that you remain healthy and are able to continue to be involved in the care. If you don't look after yourself and your own needs, you won't be as effective as looking after someone else. Deciding about long-term care may be one of the toughest decisions you'll ever make. You may have promised your person to never put them in a home. However, that was before either of you knew what this journey would look like for you. I've had people tell me that after long-term care placement, it felt like a huge weight was lifted and they were able to go back to just being his wife or their daughter and go back to having quality time with their person and not be so focused on the tasks that needed to get done. It is often better to make the move to long-term care sooner rather than later, both for you and the person living with dementia. For the person, change is easier when dementia is not as far progressed, and they will be better able to enjoy the activities and participate in the life of the nursing home, increasing their quality of life. For partners in care, we often don't recognize just how overwhelmed we are. We may be managing, however, we're not thriving, we are only surviving. And we know that dementia is only going to get worse. Think about the worst days, not the best days, when you're thinking about long-term care. Think about how often those worst days happen, and if they were to happen more often, which undoubtedly they will. So in Nova Scotia, in order to qualify for support through the Nova Scotia Department of Seniors and Long-Term Care, Continuing Care Services, you need to go through an assessment process to determine what those services are needed and to complete a financial assessment. Continuing Care's goal is to help the person with dementia live safely at home for as long as possible. They will assess the needs for care, work with you to find the right supports, and authorize and arrange services. Continuing Care coordinators guide clients and families along the way and are the main contact for accessing programs, services, and more detailed information. A Continuing Care coordinator comes to your home and meets with you and the person with dementia. The person with dementia is assessed on their abilities and needs. You are there to help provide additional information and insight into your person's abilities and needs. Other professionals, again, may also need to meet with you and your person with dementia to better understand your personal situation. The care coordinators make a recommendation for long-term care placement, and that recommendation will be reviewed by the Nova Scotia Health Continuing Care Management Review Committee for final approval. So these are some of the websites that were mentioned in this session. If any of the phone numbers or websites went by too quickly for you to catch, give us a call at your local Alzheimer's Society. The Alzheimer's Society of Nova Scotia also has other program offerings in addition to this Family Caregiver series. Through the expansion of partnerships across the province, our hope is to increase access to programs and services throughout the province. If you or someone you know wants to know more about Alzheimer's disease or other dementias and the resources available to support persons with the disease and their partners in care, please encourage them to call our office or visit our website. Our info line is a confidential service providing information, support, and referral for persons with the disease, their caregivers, or any healthcare provider who needs more information and resources. It operates during office hours and is staffed by knowledgeable and compassionate staff. Caregiver education, such as this. So the Alzheimer's Society of Nova Scotia has many more courses and workshops for caregiver education, and connect with us to learn more about those. We also have support groups, which are a wonderful opportunity for caregivers to come together for mutual support, to learn more about the disease, strategies for providing care, and available resources. Currently, there's a virtual network of support groups throughout Nova Scotia, and you can call the info line for more details. We also have available over 40 Alzheimer's Society of Canada fact sheets and brochures that are produced by Alzheimer's Canada on a variety of dementia-related topics, evidence-based research, and care practices. These are regularly updated and can be accessed on our website or by giving us a call. Thank you for joining us for session 6 in the 6-part Family Caregiver Education series brought to you by the Alzheimer's Society of Nova Scotia. It is never too early or too late to connect with us. Please give us a call or send us an email if you have any questions or you need to talk. If you are not in Nova Scotia, contact your local Alzheimer's Society for information and support.